I believe Harris has spoken a little bit to you about the condition, so I'm just going to talk very briefly about this, all in the interest of describing this new communication technology. So what you can see here is a picture showing how we treat varicose veins nowadays. It's treated from within the vein and not by removal of the vein as what we used to do 10 years ago. So nowadays what we do is we put a laser into the vein and we burn the vein, closing it off so that you don't need any operation to remove the vein. That's what we used to do. So in this picture you can see the laser under the skin. The laser is put in using a needle only, you don't need a cut. And as we pull the laser out, we close off the damaged vein. So this picture shows the patient before and after, and as you can see, not a lot of scarring on the leg after the procedure. Previously, 10 years ago, we used to have to make a cut in the groin area to remove the vein. We don't do this anymore. So Gabby, that's all I'd like to say.
Okay, thank you, Dr. Sujit.
Is there any questions?
Yeah. Oh, there is one lady asking, because he's a big fan of a high heel, and she wants to know what to do to prevent this from happening.
The only thing that you can do to prevent it is actually to wear stockings whenever you are up and about. Other than that, there's really not much you can do, because a lot of this happens to people. Sometimes it's genetic, you can't change that. And sometimes it occurs after pregnancy, you can't change that either. So the only group of people that can control are those who work in jobs that require them to stand a lot or to walk a lot. So for this group of people, wearing stockings to prevent it.
So is the high heel is one of the reason? I mean the cause of this?
No, high heels doesn't cause this. As I said, it's genetic, pregnancy, and people who work in jobs that require them to stand a lot.
Oh, so the ladies, can relieve. The high heel is another reason. So let's say you. Any other questions? Mana mau tanya lagi? Huh? Oh, the cost for the surgery.
Sorry?
For the laser surgery, how much it will cost approximately?
It costs about $5,500. $5,000
US Sing dollars?
Sing dollars.
5,000 Sing dollars. Is that requiring inpatient or a daycare surgery?
Done as day surgery.
It's a daycare surgery. Okay.
That's right. No admission is necessary. And the good thing about this is that once the procedure is over, the patient can actually get up and walk straight away.
Oh really? So no bed rest or whatever no waiting period?
Sorry?
No need to do bed rest or do it for several times.
No need to. Oh, this for varicose veins is only just a one-time treatment.
Oh, I see. Okay. Ada pertanyaan lagi? Okay. Yeah, let her ask. Pretty lady, I want to ask you something.
Yes.
Doctor, I have a stretch mark on the back of my leg.
Okay.
Right? Now, could that turn into a varicose vein at all, or do I need to worry about it?
No.
No?
Stretch mark is just your skin. Veins lie below your skin. So the stretch marks have got nothing to do with development of varicose vein.
Okay. So the best way to, but you can avoid it, or like you said, because it's genetic, then you're safe. Can you just say that, or can you actually do prevention on not to get varicose veins?
No. At the end of the day, you can't really. If you're gonna get it, you're gonna get it. So if you say you don't have any family history, no previous pregnancy, that doesn't mean that you cannot get it. It just means that your chances are lower, but it's not zero. So you can still get it. So what I normally recommend is for people who work in jobs that require them to stand a lot, like nurses or people working in a supermarket or in stores. Then those people I would suggest they wear.
Okay, thank you.
You're welcome.
Okay. What is that exactly?
They want to know more about ablation procedure. What is ablation procedure?
What it means is that the main difference is that you don't remove the vein, you just destroy it where it's lying inside the leg. That means the vein in the thigh is not removed. So in that sense, you don't need to make any cuts in the skin, and it's less traumatic. The traditional varicose vein surgery usually involves removing, that means actually pulling the thigh vein out, which is, you can imagine, is quite traumatic. So with the ablative techniques, you don't have to do that anymore. You just destroy the vein where it sits, and that's it, finished.
Okay.
So it's a heat ablation, or what kind of?
Uses heat.
Heat ablation. Okay.
Yes.
Oh, what's the cost of ablation surgery?
That's what I mentioned earlier.
Or the 5,000 one, is it?
That's right, yes.
It's a doctor, Indonesian doctor.
Yes.
Yeah, good afternoon, Dr. Singh. Can you hear me? Can you hear
Yes,
me?
I can. I can hear you.
Yes. Thank you. I'm Dr. Eddie. I'm from Advantcare, Indonesia. Just discussion because we have so many workers working with lifting and handling with heavy equipment. And some of the cases is about the varicose of vein. If we do the ablation to the people, something like that, how the prognosis, whether they can return back to their job, or there's something like to other job or something like duty after the operation. Can you give me some advice?
Patients with varicose vein.
Pardon?
Patients with varicose vein.
Yes, after the operation. Yes. Yeah, he's asking whether those patients with varicose veins, after treatment, can they return back to the same work, or do they have to be relocated to other jobs?
Definitely. No, generally they can return to the same work. The only thing is like if I have patients who develop the varicose veins purely from their work. Say for instance, a young man, 20 years old, who gets varicose veins, who has no family history of varicose veins. No one in his family has varicose veins. But because he works in a food stall, spending 12 hours a day, if he develops varicose veins, after the treatment, I normally recommend when he goes back to work, wear stockings. But he can't go back to his same job. But he should wear stockings. If it is someone like a lady after pregnancy who develops varicose veins, but she works in an office, not a problem at all.